This is Anthony Kilner here with our Supernal Interview Series, and I've got a special guest with me today, Malcolm Ware from The Vet Practice in Whittlesea in Victoria. Welcome, Malcolm.
Thank you for having me.
All right, so this interview is sort of going to coincide with the story we're doing in this December issue of the magazine. And it's all about animals and animal health and welfare and working on obviously very different lines and approaches. So we've got the spiritual approach to what we do, and then we have the more Western approach, which is where you come from. But my and Jane's experience working with you and your team has been quite different, because obviously we have had to amputate Jet's leg from cancer, and from also having a cruciate ligament problem at the same time. But you take a very different holistic approach to your work, and that sort of has impressed both of us. But I guess what we should do, start off, who is Malcolm Ware? Where do you come into the picture?
Where do I come from? Basically, for the whole of my life, I've always wanted to be a vet. From my early childhood, I don't actually remember anything else. There was, for me, not another option. And even as I went through school, even finishing school, I actually don't know what I would have done if I had not got into vet science. Even in that final year, it was still, this is what I've got to do. So basically, it was all I ever wanted to do, and that led into initially going into mixed practice. So cattle, horses, dogs and cats, that's what I believed I wanted to do. And as a few years passed, I realized more that I wanted to actually focus on surgery, strangely enough. And then as I started focusing on surgery, I started seeing that there must be a lot of other options, and as such set about building my own practice whereby we could direct the way treatments and everything went, and be able to bring in a whole lot of other avenues to achieve the best results. So from what started in I'll show my age here. What started in 1987 as a one vet, one nurse practice is now a 13 or 14 vet practice, with encompassing just about every area that is possible.
Mm-hmm. Well, I guess we've had quite a bit of an interaction with several members of your team. But so that passion's been with you from a child. So, and that's, I guess, it was always something you want to do. Was there anything that triggered that, or was that just something that you just absolutely wanted to do?
If I had to say something triggered it, I think my mother was always passionate about animals. And I think probably being the youngest of three boys, I was probably influenced significantly by that. Mm-hmm. I actually grew up in the country, in Seymour, actually. And I think just the environment plus her probably influenced it early, and I hung on to that.
Okay, well, I guess it's the fact that you're still doing what you're doing and you're still passionate is pretty important.
Yeah, well, to be honest, I graduated now in 1983, so that shows how long I have been in practice. And if anything, I probably actually love it more now than I did then. And there's so many areas to continue to keep growing in.
Yeah, well, I guess the thing that really that impressed us, right, was your no-nonsense attitude. I think that's obviously the country person in you. It's just like, well, this is your option. These are your options. This is what's going to happen there. That's what's going to happen here. This is what we can do here. It's really nice, I think, from our point of view, to have somebody that's so honest. And I take it that you've been like that all your life as well.
Yeah, we've always tried to give people the best options, and to make people understand that there is always more than one option. I think too often a lot of veterinarians just go down the track that they're comfortable with, and they'll just stick with doing the same thing without looking outside the box. And I believe that you should look inside the box as well as outside the box, so that you can do the best job possible.
Well, I think if so, for our viewers watching this, referencing this back, you know, when we first brought Jet in there to get looked at, and we found out ultimately that she had the bone cancer, very early stages. Our breeders that we knew, people we knew, were just saying, you know, just put her to sleep. That's it. That's the end of it. Yeah. And, you know, I think seeing her so drugged up for those few weeks, those 4 weeks or so, that because she'd had the cruciate problem on the same leg, really led us down the path of, well, are we doing the right thing for her? And one of the best things I think we did was sort of listen to what you said, and that was, you know, she will be okay. She's young, she's fit, she's, you know, all the right things. So yes, you can do this and you will be fine, or, you know, as fine as we can be, knowing that cancer will always come back. But the difference between her pre-surgery and post-surgery has just been phenomenal, and her recovery has been phenomenal. And I think we've absolutely done the right idea. But I guess if we're talking in this case, you know, cancer amputation is quite different from damage from a car accident or damage from deformity, but you can still get really, really good results.
Yes, yeah, you can. I think too often we think of cancer as being a end diagnosis, whereas very often cancer can be treated as any other chronic disease. So that you know, you treat kidney disease, you treat liver disease, you treat arthritis. A lot of cancers can be treated along the same lines to get many many years of good quality of life in some cases. And it's important to get that early diagnosis and early action, because that gives you the best chance of achieving that. Also, when it comes to amputations, I think people need to think about amputations in a slightly different way, because in Jet's case, we had to do a full limb amputation. And in my mind, that's the worst form of amputation that I can personally do, because the whole limb's gone and there's nothing that you can do about that fact. But you can help that with a lot of exactly what we're doing now, which is rehabilitation therapy and ongoing care. In a lot of other cases, we actually have the ability to do a partial limb amputation, and that is actually not very well known out there in the community, that if it's a lower part of the limb that either has cancer or is damaged by an accident, we can actually remove part of a limb and then create a prosthetic custom made to actually fit on that limb, and then maintain good weight bearing through all 4 legs. So there are lots of options if you're open to them. And unfortunately, you often need to go looking for them, because I find even today there are a lot of vets that have no idea that you can actually do a partial limb amputation and put a prosthetic on reasonably easy. You know, not with the difficulties that were around 10 years ago, where you used to have to get these prosthetics from America. We have them made by our own prosthesis and fit them, and those dogs actually do really well.
Yeah, I have to admit, I did see a video the other day of a dog that had, I'm not sure what the overall problem was, that there were 3 legs missing. And they did some prosthetic limbs for her front legs, and they were expecting her just to be able to sit there and prop herself up, but within like 10 minutes she was running around, and it was one of the most sort of tear-jerking videos I've seen, because I guess the fear of us going into the amputation was, well, what are we doing to our dog, and are we and we didn't know whether she was still going to have a quality of life at the other side. And I think that's where we had to trust what we were doing in the process, because I think most people that you would see when it comes to this would have the same reservations we did.
Yes, yes, they do. They do. It's a very confronting issue, but often how I believe that you've got to think about it is, in the initial stage, you actually have a limb that is painful, and that is actually hindering them from getting around more, so that when you've got a limb that's damaged, when you've got a limb that's got cancer, the movement and use of that limb is actually painful, but they still manage to cope and have a good life. So often these dogs are actually happier once you remove that limb, because you are removing the source of pain, and it's amazing how well they cope. At the same time as doing Jet, I did a partial limb amputation on a Kelpie the other day, which is actually having a prosthetic fitted. But even without the prosthetic, that dog's out working sheep.
Yeah, I did meet that dog pre-amputation, and then saw it after, and yeah, and they were saying that he's just up and doing everything they're supposed to be doing, running around with the sheep. So
yeah,
I think that's good. And I mean, I notice, with Jet being able to run around on the property here, and the happiness that she's had. Yes, she wasn't all that comfortable for the first few days. However, it's just been a progressive, ongoing, I'm getting better, happier within herself. And for some strange reason, she still loves coming down for rehab.
It's probably the food that's involved in it.
Well, we're trying to cut that back a little bit. So that's it. So in your holistic view of the way you work, I mean, you're using hydrobaths and pools and laser treatments and all that. What sort of took you down the path of going down such a holistic route for rehabilitation and dog welfare and animal welfare?
Okay, so it was actually many faceted, I suppose. For many years, I was in mainstream practice, and you're doing your daily consults, and you're seeing patients for the conditions that are presented to you. And I found that myself, as with most other people, you were addressing the condition that was in front of you at the time. Mm-hmm. And you weren't taking into account all of the necessary pre-existing problems that were there, or what the compensatory problems from what you were treating, where that was going to lead. So you would see a patient for a quick consult, you'd treat it, and then this would just keep going. And either your pre-existing problems would get worse, or you'd start to see compensatory problems. So in my mind, I just thought that this was a massive hole in the way that that animals, and I think even in humans, are being treated. And so it sort of started the holistic journey by saying, okay, well, we need to look at what comes before and what comes after, so that can become part of our overall treatment plan, so that we're looking at everything right from the word go. Yep. The other issue that I found was there was a huge difference in people's approaches. There was this whole side that believed in conventional medicine and nothing else. And then there was this whole side that believed in complementary or natural medicine and nothing else. And in my mind, the two actually work extremely well together. But I didn't see a lot of people bringing them together. You either did one or the other. And so I decided that it was time to look at it from both sides and bring them together, so that they could actually be true complementary medicine and complement each other.
Yeah, well, I think
Sorry.
I was just going to say, I think from the fact that how much I've bought into the thing about the patches and the healing and the energy work and the water systems that I've been using with Jet, you haven't sort of scoffed or laughed at me, which I thought was being very generous of you.
No, I think everything's got its place. It's some of us will believe that some works, some don't believe, but I don't believe anything really can be scoffed at, because you see each day you see amazing things happen. So and from the back to the question, from the rehabilitation side point of view, at the same time as doing this, I was also doing a lot of orthopedic surgery, and I believed that we could produce better outcomes by adopting a lot of the physiotherapy principles of people, and following these patients post-surgery rather than confining them to a cage, waiting for it to heal. So that's when I started down that whole track of rehab, and then that built to bring in the modalities for treating a lot of these other conditions. So then wasn't just about dogs that have had orthopedic surgery, but it then became more about, can we improve the quality of life of geriatric dogs? Can we prevent a lot of the problems that we're seeing? And that has become a major focus as well.
And again, yeah, it's very obvious when we've seen some of the animals you've been working with. Is there I know you do a lot of dogs. Are you doing other animals as well?
Yes, yeah. The main rehab patient is probably the dog, but we do see a significant number of cats, especially aging cats, because they get a lot of spinal issues, and we manage to be able to help cats maintain their mobility very well. We've done a few rabbits, and using both rehabilitation and regenerative medicine, we've treated quite a few sheep and goats as well, and I've even got quite a few sheep in braces, custom made braces to help support their legs.
Okay. Is there a particular sort of breed or animal that you just love in general over? I mean, I know what sort of dog you have, and I know your dog's pretty special, being, having free run of the place. But yeah, is there a favourite?
Actually, there's not. It's dogs and cats. You've seen Dusty, who I bring to work, but I've actually got 3 dogs, and we've got 5 cats. So they're all actually just as special as each other, and as any owner would say, they're all different. It's just Dusty happens to live the good life and come to work every day, and go for a swim just about every day too.
Yeah, well, I think Jane had the experience of him being covered in mud at one point because he'd been running around in the paddock with you.
Yeah.
But it's a good thing when you can have your mate at work, isn't it?
It is, and he's my 3rd dog that's actually been at work with me all the time. Prior to him, there was another coolie, and prior to that, a border collie. I don't think I've actually ever been to work without a dog with me.
Our last Rottie, which was had to be put down and was done at your practice a few years ago now. She used to come to work with me every day. She would just lie under the bench, and Jet is a bit too boisterous for that. So she decides she wants to hit your arm. So you'd be typing away and the arm will just flick up and says, stop, I can't concentrate. So yeah, so she doesn't come to work with me all the time, but she's annoying the hell out of Jane up in the office where she's working at the moment. So that's a good thing. Well, there are a couple of questions. I mean, what gives you the most pleasure in your work, and do you get attached to the animals you treat?
So the most pleasure comes actually from being in a position where we can dramatically improve the quality of life of our patients. So we see a lot of dogs with chronic ongoing conditions, and basically they've been put into palliation. They're on, I saw one the other day that was on 16 tablets a day. They're put on these huge numbers of drugs just to control the pain, and they've been given the advice to limit the dog's exercise. So my greatest pleasure comes from being able to get these dogs into a rehabilitation program, start using a lot of the modalities that we've got, run through exercises with them in clinic, teach the owners exercises at home, and get them to the point where they're able to exercise again, where they're able to move around, where they're able to be your companion again. And at the same time, be able to decrease the number of drugs that they're on, so that we can not only increase the quality of life, but increase their life expectancy. And it's amazing how many of these dogs, within a very short space of time, we can say, well, you're no longer being palliated because you're having a good life. And that probably gives myself, my team, which I must admit are a brilliant team, and the pet parents, I think that gives the best buzz of all.
Yeah.
So
yeah, well, I know our buzz, so yeah, it's important. So yeah, so do you end up getting attached to them at all?
Oh yes, you spend so much time with them that you get very, very attached, because it's not like general veterinary practice where you might see somebody for a consult and then they're back for a revisit, because you're seeing them frequently for rehab, and you're dealing with them in often in a very good environment, I feel, where they're relaxed. So I find the dogs become a lot more friendly with us, so they actually almost become like your own. And when you go through, a lot of these dogs are in intermittent rehab for years, and so it becomes a very, very sad day. At the end, eventually, you get very attached.
Yeah, I've been reading some of the pictures and the wording you've got on the walls out there, and of dogs and letters from parents once they're passed over, and yeah, it's some pretty beautiful stuff there.
Yeah.
But being a dog lover and being a dog lover all my life, I just can't imagine living life without a dog.
No.
Around. It'll surprise people to know I'm not a huge cat fan. However, I don't hate them or anything, but I'd rather just have my dog that I can give a cuddle to, and that's what it's all about, really.
My comment to anyone that says they're not a cat lover is you haven't met the right cat. Because dogs tend to attach themselves to you very, very quickly, and cats, some can be aloof and some can just melt your heart.
Yeah.
When you've met one that melts your heart, they're great.
Yeah, well, we do have the chickens and the ducks and everything else. So, but I should say this, because Freya, my deputy editor, has a couple of cats, and Eclipse has become sort of almost like they're in WA. Sort of, that's my pet cat from WA.
Yeah.
So yeah, I totally get it.
Yeah.
But again, being an animal lover, it's just, it doesn't really matter. You just do what you do. Now, You did make a comment about your rehab and helping people to understand the importance of it. So obviously teaching teaching people how to do the rehab at home is a big part of what you believe in. And so take us through why that's so important for the owners.
Okay. When we're embarking on a rehab program, it's important that exercises are done frequently and that they're done well. Now, there's only so many times that someone can come to a clinic to have that done. And to get the best outcome, which is what we're after, the more often it's done, the better, because then you're going to get the best strength out of it, the best functional limb out of it. However, one of the big problems that we see is because of the internet, people go, oh yeah, I'm going to give my dog some exercises, and they go online and say, yes, I'll do that. They're going on and they're just looking at an exercise and saying, that looks good, I'm going to do that. It may not be the right exercise for the condition. It might be too early in the condition's progress to do that exercise, or they might not be doing it right. And so from our point of view, one of our big things is assessing the patient, choosing the right exercises at the right time, and teaching those to the client so that they're doing it correctly. Because an exercise done incorrectly may not as well be done, and it can actually be detrimental. So we like to make sure that posture's correct, position's correct, you're not over fatiguing, and that you're developing those exercises in line with the body's condition, not just jumping from exercise to exercise because it seems like the right thing to do. An example of that is if let's say you've got a leg injury and that leg has wasted away, so it's got much less muscle mass. A common school of thought out there says, oh, just go into the underwater treadmill, because the underwater treadmill is the big ticket item that that most people know about. However, to go into the underwater treadmill, that's a mobility exercise, but that leg actually isn't ready for that. We need to build some of the muscle that stabilizes that leg and stabilizes the joints in that leg first, so that we can then move on to more exercises like that.
Yep.
And that's what we try to get across, so that we can build things in the right direction to get the best outcome.
Yeah, which is, and again, it's something obviously we are learning firsthand with Jet, and you know, with the time and effort we're putting into her rehab as well.
Yeah, and Jet's a very good example of that, in that that's why, just as we were talking yesterday, we focus on those standing still exercises, so that we're building those stabilizer muscles, so that she's got that strength in those joints when she goes outside for the walk or run. Otherwise, that's just putting those joints under too much stress.
Yeah, yeah, and we are, you know, really trying hard to get our rehab stuff here, you know, spot on, and we're lucky, we've got a great place where she can run uphill, down dale, and that's really working all her muscles, plus the stand-up exercises that we're doing with her. So and again, she's happy enough, so you know, for us that's just huge.
Yeah.
So then we come to, I guess, one of the sort of getting towards the final questions part of it. What's the hardest part about dealing with humans, you know, with major animal traumas, and what suggestions would you give to people to help them deal with that?
That's actually quite a complex question. I think the hardest part on dealing with it is that what we do is one of the rare areas where very strong emotions and finances come together in a very bad way. It is the hardest part, and I think it's made a little bit harder in Australia because we live in a very lucky society where very few people understand the true cost of good healthcare. So people look at veterinary fees and think they're expensive, and then that mixed with the emotion becomes a very, very difficult area to deal with. So what we try to do, or I try to do, is I try to come to this balance between what is going to give us a good outcome and what the individual can afford, because there are two sides to that coin. You want to do the best job possible for the patient, but there's absolutely very little point in doing that if it puts the pet parent or the client into a difficult financial position. So you've got to balance this all into this approach. So from my perspective, everyone likes talking about gold standard. The gold standard for this is that, the gold standard for this is that. And in veterinary medicine, they talk about the gold standard as being the best procedure to do on that patient. Yep. In my mind, that is not the gold standard. In my mind, the gold standard is what is the best work that I can do for that patient in line with the client's budget to produce the best and satisfactory outcome.
Mm-hmm. Yep.
So from an advice point of view, I would suggest to anyone that always ask a lot of questions, right? Like you did with Jet. The questions kept on coming, but that's good. That's good because that means that you're thinking about it, right? And you need to think about these things deeply. You should never be put in a position where it's make a decision now, right? There's very few cases where that is necessary. It does happen. Bloat or snake bite, you might be in that position, but apart from that, it's quite rare that you've got to make a decision that quickly. So always ask a lot of questions. Also, know your options. You know, don't just think that there is only one option for what I need to do with this condition. There are always more than one option, and know what they are so that you can assess the whole issue. Always be honest about your budget. So, because as veterinarians, we hate having to bring money into it, but it's a fact of life. And it's pointless trying to hide from it. It's pointless trying to hide from the fact that that things cost money, because it does. And you know, it's at the end of the day, it's a business like any other business. So things do cost money, but when there's a really good dialogue between vet and owner, and you know honestly where a person is budget-wise, you can develop a holistic scheme moving forward to achieve that best outcome. I think that's one of the major points of it.
Yeah, and from our perspective, we did a lot of research. As you know, we spoke to quite a few different places, and you know what we were looking for was somebody that was going to care for our Jet the way we did and do. And so that and that came across very quickly when we went there, because obviously your time, you know, the amount of time she spent with us talking, going through it all. Yes, we had the budgetary discussion. However, for us, it was a balance between if we had to do the cruciate ligament, and we know that was like a 6-month recovery time. We knew it was going to cost, you know, $6,000 or $7,000, and you know, whatever, you know, the final outcome was going to be. So, you know, I think that honesty across the board has always been very good. I would be saying to my listeners here, talk to the people and find out if they are passionate about what they're doing. Because, you know, as you know, without mentioning any names, you know, we were told that she'd be in and out with her cruise ship within a day. And you guys never said that from day one, you know, and even with the amputation, it's like, she's not coming home until we're happy, you know, and that was a big difference for us. You know how much Jane loves Jet and how much I do. She's our fur baby, regardless of what people say. But the understanding is for listeners of this, it really helped us to find the right vet for the right job, you know, and doing it in the way that's been done. So yeah, that's just adding my perspective.
Yeah, no, I think that's a very good perspective, because one of the big things out there is cost, and I think people need to be aware of the fact that cheapest is not always the best, and unfortunately you can be driven to saying, okay, that place is cheaper than that place, but that's usually because something's left out. And that can be that aftercare, or that can be the way the pain control is managed, something like that, because wherever something gets cheaper, something's got to be cut. And I look at leg amputations or cruciate surgeries, and they get done and they go home the same night or the next day, and they're in pain, but it's the dog that suffers. Whereas, as you've just said, you know, we keep them in till that pain's under control, because we have them on extremely good pain control post-surgery, because we want them to be comfortable. And when they go home, they want to feel comfortable. And when they go home and they're comfortable with you, then you feel better about the whole process. Whereas if they go home and, as we often hear from different places, they go home and they're crying all night and they're unsettled and they're moving around the house. Not only is that painful for the dog, but it's a very bad experience for the owner as well. And it's just not fair on anyone.
Yeah, and again, we were very lucky. As you know, Jet's brother, who's now passed away, had cancer as well, and her owners, her parents, gave us a very good, open, honest discussion before going ahead, and I think they prepared us for the worst, and we didn't get to where we thought was the worst. So, you know, yes, plenty of sleepless nights, but not because of the pain management, but because, you know, Jet just needed that assurance that we were there and everything was good, and, you know, and she can be demanding when she's normal.
Yes, yeah. But you know who taught her that?
Probably Jane. I take no responsibility for that at all. So no, it is what it is. Look, so is there anything else that you think we should be helping people out with any advice? I think we've covered a fair range of questions that most people would want to be asking and looking into.
Yeah, I think the only last major piece of advice that I would give is always look for options, and even talking to your own vet, they might actually not even know what all the options are out there. So don't think that anyone's going to be, any one person's going to be the source of your all-encompassing information, because they're not. So always do your own research, because there will always be more options out there than what you think.
Yeah.
And some of those options might be better options for you or your pet.
Yeah, and I totally agree with that. And again, you know, we talk to breeders, we talk to our normal vet that we've been getting Jet seen by, we talk to my parents that were breeders, we talk to people that had dogs with limbs removed, you know, and we went through all of that in that 4-week process from diagnosis or first injury that we brought her in for through to that amputation. And I can't suggest enough to people to really do that work. Don't just trust blindly what one person says. If you're in doubt or you're not sure, ask. And I think, again, when we were talking to you about it, and Jane sort of was saying, well, chemo versus not chemo, we're not keen to do it to ourselves. Why would we do it for the dog? What are the chances? And then when we went and saw you, of course, you had all the best statistics you could get your hands on. And it's sort of, you know, we really did sort of look at that weighing up process. But that's the sort of stuff that I think people need to be looking at, where it happens and why. So, okay. Well, I think that has given viewers a bit of time to sort of look at things in a holistic sort of way when it comes to their vet and vet care, especially with serious sort of trauma and the story we're doing around Jet. So thank you very much, Malcolm, for coming online and spending some valuable time trying to help our readers understand what can be a very traumatic experience.
No, it was my pleasure. So.
Okay, so thank you, and that's great. We'll sign off at that.